described the clinical manifestations of narcissistic personalities very similarly to the way I did. So there was no problem there. I disagreed with him totally regarding his developmental schemata. He thought that the grandiose self was to some extent a normal structure. I think it is a definitely pathological structure. And we also disagreed in the treatment. He developed a particular way to try to gratify and modify the grandiosity. I'm applying a traditional psychoanalytic technique, very related to that of Herbert Rosenfeld, John Steiner, Ronald Britton, Edith Jacobson, analyzing the pathologic grandiose self to resolve it and permit a normal self-concept to develop, so that I degree regarding the developmental features and the structure of the narcissistic personality disorders and regarding the treatment. We are definitely better at diagnosing it, better at diagnosing all personality disorders. We have no good epidemiological information about real increases of personality disorders, because there has been such a shift in the nomenclature that it is difficult to compare different studies carried out at different times. And what we do have, rather than really good statistical evidence of any increase in personality disorders, is clinical evidence and observations that are pretty general, so that one can assume they correspond to reality. And I would make 2 points here. One, that there is a relationship between the stability of social structures and the observed prevalence of personality disorder, because stable social structures create an external social structure that decreases or inhibits the pathological behavior of personality disorders. At times of rapid social turmoil, social change, revolution, disorganization, crisis, there seems to be an increase of severe personality disorders, because the usual social structuring control of these disorders is not working. That's one reason. In addition, it seems realistic to think that there is a definite increase in severe personality disorders for example, in the center cities of the United States or other metropolitan areas in which there is a high density of population, extreme poverty, disintegration of the family. Adolescent girls get pregnant, and then grandmothers carry out the mothering functions while the children grow up on the street. So there is a lack of a normal family structure, in addition to prevalence of drugs, criminality, and lack of any motivation for normal socialization. So the combination of all those circumstances clearly fosters a development of personality disorders, because disorganization of the family nucleus is a very important source of traumatization, together with physical trauma, sexual trauma, and chronic witnessing of physical and sexual trauma.